Buongiorno a tutti quanti. You have just heard who I am, but I would like to draw your attention to the picture which you have seen on the program. That is a picture from Jurassic Park. And among all the authorities, I don't call them dinosaurs, authorities who are there in the Institution for Rehabilitation here in Udine, I was one of the many. At that time, I was already very sensitive to public relations. I was thinking, well, in 30 years, this picture may emerge and they should recognize me. So that's why I wore the dark jacket on that picture. So the rest is fading away. Like the heroes from old days, very difficult to see who is who, but the one in the blue jacket is still very much visible. What is not visible is the words that were written over there. I keep my hands like this, so nobody could see it. But when you look at the enlargement, which is also available, the big picture, you can't see it either. You have to go to CSI, crime science scene investigation, to have a technique to find out what is there. And when you read it, what's there, it says, a l'empio che mi trasse di estremo, qui attendo la vendetta. So that was the message I brought to my dean back in Maastricht, and he quickly appointed me professor in quality assurance in healthcare. I was asked to tell you something about quality assurance in undergraduate medical education. This was the assignment given to Professor Victoria Čučić from Belgrade, at that time Yugoslavia, who unfortunately cannot be here. She is a little difficult to reach the city of Udine from where she lives. So she sends her greetings and has asked me to say something about undergraduate education and quality assurance. The answer I would like to give you when you ask me, well, what is teaching quality assurance to medical students, and especially what shall I do in teaching? My answer is, don't do anything. It's not the right place to teach quality assurance, quality management, quality assessment. And that's why we can hear in a minute the presentation from Dr. Jesse, who actually is the right man in the right place, at the right moment to do this in his incomparable way. Well, what can you do then? Especially when all of a sudden you've been asked to bring quality assurance to medical students. Usually the dean or the curriculum committee tells you, well, I give you Tuesday from 10 to 11. So for students then, quality assurance is Tuesday from 10 to 11. A time perhaps to stay away. That's a thing that I very much remembered when we in the Maastricht University tried to set up something like quality assurance for medical students. And what we did is simply we brought them quality. We let them discuss quality. We let them look at quality. And just to give you an example, because the work in that university is in groups. We have no lectures there. We bring the message to these groups in the form of documents, press releases, pictures, etc. And the various year groups have once a month an encounter with quality, which they also can read in the newspaper, see on television. And we ask them, what's your opinion? What could you do? And it's very good to see that from year 1 to year 5, they grow in appreciation of this. They become more mature in their answers, and also they become more critical. And the more they need the day that they will be in practice, the more critical they become about their colleagues and about the things they apparently haven't done well. But just one example of a way, and I think a very powerful way, how to introduce quality and everything what's around it to medical students.